here you come. I will be doing another review. As I said, I'm making another Kahoots. I'm also looking at some next gen questions that maybe I'll throw in. I've been looking at them, trying to figure out which is the best way to give you what you need, okay? So I'm working on it for you. So let's go ahead, let's do our Kahoots. We should be out of here about 8:15 by what happened with my last class in the Kahoots. Let me get it pulled up.
Cool.
Anybody have any questions? Yes, I know everybody wants their exam grades. I'm sorry, I can't do it. But I will give them as quick as I can tomorrow. As soon as we meet, I'm pretty quick in getting them immediately released to you. Yeah, it's been a great class. I've enjoyed each and every one of you. And now it's just on the down low. Now we just got to get through the HESI with all of you. So I'll work hard to give you your information. You work hard studying, and we'll get you through pediatrics. You know, just looking, I had 100 and 298s. Unbelievable. And that was not an easy exam at all. So thank you guys for working so hard. I feel like proud mom. I really do. All right, let's get going so we can get out of here. It's Friday night, right? I have nowhere to go, but it's Friday night. I'm gonna barbecue. That's what I'm gonna do. A toddler has a Broviac catheter. While playing, the IV tubing disconnects from the catheter. Priority action. What do you need to do? Well, you gotta look at what is a Broviac catheter. It's a central line, and that goes catheter right into the heart. So it's access right in to the inside of the body. So that thing is disconnected. Number one, what do? Number one, you're going to clamp it off. Then we're going to get hold of the doctor or the IV team, whatever they want, to come and look at it and see what needs to be done. I've seen them tear, they've had to do repairs, all different things. But because it's been open to the outside, most likely they're going to want couple doses of antibiotics to prevent, blood sepsis. It's a very serious thing that happens.
I see.
An infant just had a cleft lip surgery repair. Why should you minimize the crying during the post-operative period? Like, why do we want a kid not to cry? Just had that cleft lip repair. And remember, cleft lip is at 2 to 3 months old, and it's a plastic surgery. We want to have all those edges approximated, and that crying stresses that lip and could create a crooked lip line. And you will notice it as that child gets older. And we want to have it as a pretty lip as we possibly can. A child has a central line for treatment of ALL and now has a fever of 103. What intervention is most important? You have a central line, you are immunosuppressed, you have leukemia, you're under chemo, and you have a fever. Well, the most important thing actually is those blood cultures. We want to make sure it's not the central line causing or being the source of infection. Just like the one that disconnected, this is probably going to do blood cultures there too, but this one, absolutely. Yes, absolutely. They're going to be given IV antibiotics for this, because of the immunosuppressed condition, but we want to make sure that that central line is okay, because again, you could go into sepsis. A child is scheduled for the reduction of an intussusception and passes a soft brown stool. What intervention? What do you need to do when you see that soft brown stool? Then you have to go back and look. What is an intussusception? What happens? Remember, the intestines suck up into each other, and you usually see current jelly and blood sort of in the stool. And if you see stool come, that means that that intestines has opened. That means it reduced by itself. They don't need to do any intervention now because the intestine corrected itself. That soft brown stool says there's a passageway all the way. So we call the doctor, let him know it's corrected itself. Nothing more needed to be done. A multi. What foods are important to introduce to an infant after they are 6 months old? Now, we know that the first 6 months of an infant, their intestines, their GI tract is very immature. So we only give them breast milk or iron fortified formula. And then we start introducing foods. So sliced beef, yeah, that's for the 3-year-old kid, right? That's what I'm going to have tonight. I'm going to have a nice steak off the grill, but not for a little 6-month-old. Whole milk is at 1 year, so that's a little bit too late. Pureed fruit, rice cereal, strained vegetables are all appropriate. Fruit juices at this age is empty calories. That needs to be milk, okay, or being breastfed. Fruit juices are after 1 year old that we would introduce them, not this stage, okay? A mother says that her child with spina bifida sneezes and gets a rash when playing with balloons. What type of allergy is this? And I have the same one because of the amount of, back in the early 80s, they didn't have different types of gloves that I could use. They only had latex. So using latex gloves all the time, I literally had a red rash on my hands. I mean, my skin peeled off. It was so bad. But today in pediatric hospitals, they do not have latex gloves anymore. They have all different types of it because children do get allergies and children's allergies are severe. So latex allergy from birth, doesn't matter. Put a sign, this child with that open area of the spinal column now has latex allergy. Remember, latex allergy also is also avocados, bananas, and kiwi. Those 3 things you have to be very careful with latex allergy. How can you reduce an infant's risk for otitis media? You know, infants get, and, you know, young school kids get a lot of ear infections. You know, we need to know, is there something we can do to protect those ears? So remember, they're short, wide open tubes into the back of the throat. So if we just sit them up while we're feeding them, the milk's not gonna go and dribble back and up into the ears. Because remember, your mouths are full of staph. That's just normal. It's just what we have. So that liquid gets up into the ears and then you have an ear infection. So holding them up during feeds is what we need to do. And adolescent psychosocial development focuses on what? Remember, adolescence, what does Erickson say, right? That's the most confusing level, you know, when we look at stages of children, most confusing because they're old enough to understand, but they're not old enough to understand all the emotions. And it's all about identity. Remember, this is where they struggle with body image, right? Who am I? What am I going to be? It's like all this pressure now is put on them to make decisions and choices. A 10-year-old is in the acute phase of rheumatic fever. What activity is appropriate for the nurse to schedule in the plan of care? Remember, rheumatic fever is due to a strep infection that wasn't completely treated. It attacks the body as a fever, a malaise, tired. You'll get rashes, you'll get nodules in the joints, and you also can have heart valve damage. So the one thing that we need to plan is these children do need to be active. They don't need to be on bed rest. They don't need to be quiet. They just need to be up and be ambulating to prevent any side effects. You know, the lungs, pulmonary atelectasis or blood clots or whatever, because children do get those sort of things also. So not extraneous activity, but up and walking. An adolescent is very depressed. What findings may indicate a risk for suicide? The one thing that we're taught about children, and if they say, I wish I would die, take it seriously, because children will commit suicide. And if they say their friend is feeling that way, it's something that you need to act upon, because children do things like that and they don't understand the ramifications. They just don't. They're just, I don't like me. Nobody likes me. I don't like what I look like. I'm not this, I'm not that. So the other thing we hear is, so what happens when you die? There's preoccupation about death. What happens when I die? Do I want to be cremated? Do I want to be put in a box? I mean, all of a sudden you'll get these questions. They're like, why are you asking things like that? That could be a sign of, suicide, that the child's depressed, something that needs investigation, needs to be looked at very seriously. So a child's admitted with depression. What finding is most significant? Confirming depression. Remember, any age child can have depression. I've seen it, with toddlers all the way up, and due to many different reasons. We know they do that withdrawal sort of thing and, are not as active with people, but it's, as they get older, you see that sadness. They're just always sad. Nothing makes them happy. They're not giggling. They're, by themselves. They're lonesters, but it's the sadness is what you see. Why would you mix an iron supplement with orange juice to deliver the dose? Now we know liquid iron should be given through a straw so it doesn't stain the teeth, because it's that thick brown liquid. But, either you mix it in it or you take it with orange juice as a chaser behind it. And it's because orange juice helps the iron to break down and be absorbed, because iron is absorbed through the stomach. So the stomach acid, there's some, but the acid of the orange juice also helps it break down to be absorbed in the body. So you get a better dose of iron. Remember, iron can cause constipation. There was a question regarding constipation on the exam, and a lot of students wanted to give high in iron foods. You would do the opposite, because iron constipates you. What would you expect to see when assessing a child with impetigo? I was telling some student earlier, impetigo, my grandson had it. And it was my grandson had some scratches on the back of his leg, and he was scratching it. So there was open sores. And mom thought he had just itched it so much that he created this infection. Well, when you have a little sore, a scratch, for whatever reason, the skin it has staph on it. It's just part of, what we have. And it goes in these wounds and it becomes an extremely infectious, contagious, sort of oozy, weepy sores. They are honey-crested lesions. That's the liquid that's sort of juicing out of them that dries up. And literally those things, we should remove those tops of those crusts, and then we give them oral antibiotics and we give them also topical on top. And we don't give over-the-counter antibiotic ointment. This is the Bactroban that we, is from the pharmacy. Very strong stuff. It took me, and I knew what it was immediately, over a week to heal this child, to get him on the healing path. I mean, it kept spreading. And then, of course, I had to be careful with it. A 7-year-old school nurse has a 7-year-old with an asthma attack. They can't speak, they're cyanotic, decreased in shallow breath sounds. What is your priority? Asthma attack, can't speak, he's cyanotic. He has decreased in shallow breath sounds. What do you think you're going to need to do here? You're going to get ready to ventilate that child. And, you're probably going to have to call 911 at that point too, if that's happening. So number one is airway. Take care of the airway. Make sure they have their breaths. And then we call 911 or yell for help, right? Infant develops arm-leg movement before fine motor finger skills. This is an example of which pattern of development? This is called proximal distal. It starts proximally, close to the body, and then they start working out and seeing things and reaching for things around them. Cephalocaudal is when they lift their head first, and then they start those gross motor, turning over, rolling front to back, creeping, crawling, walking. Proximal distal is when they start using the arms and the legs and exploring the world. Status post cardiac catheterization 2 hours ago via right femoral artery, which finding indicates arterial obstruction. They put really thick catheters up there in order to sometimes put in devices that can take care of the issue, or it could be infusing dye, looking where the blood flows. But how do you figure out anything where you have an artery if there's decreased blood flow? Well, you check pulses, neurovascular signs. Part of that neurovascular signs is, you're going to see that right foot's going to be cool, pale, and blanched. And of course, your capillary refill is probably going to be like 8, because now there's no blood flow going down there. So that's distal or down to the foot that you're going to see that there's an obstruction. The other thing we're concerned about cardiac catheterizations, because of those big catheters, is bleeding out of the site where they stuck it. It's always the first thing I check, is that dressing. So a toddler has a spica cast on because of a motor vehicle accident, and he wants a toy. What is the most appropriate toy to give him? I mean, spica cast could be on because of a fractured pelvis, and they want to keep that pelvis immobile. And with a toddler, they just won't lay in a bed quietly. They're going to be moving. And these spica casts go from the nipple line down to the knees. Now, all the other toys here, most of them are you can crack the cast with it, right? Dolls, they can bang it. Video games, squeaky duck, he's not really going to want that. But little soft hand puppets are a great thing, or giving something to color, or little soft blocks, etc. But you don't want anything hard. He's going to stick it inside of there, and he's going to be banging on that cast. So an infant with tetralogy of Fallot suddenly goes cyanotic and hypernypic. Priority action, he starts breathing fast. Tetralogy of Fallot, right-sided problem, where the pulmonary artery is stenotic and then a piece of tissue covers it. Now, no blood flow goes up to the lungs. So you put this kid in a knee-chest position because there's different pressures in the abdomen and the chest cavities. And knee-chest forces that abdominal pressure to go up and changes the pressure in the chest. And most of the time, whatever's blocking that blood flow to the lungs will come off. You know, older children, some of them are not repaired at birth. They have tet spells. And just because, I don't know why, they just know, they'll just squat down on their knees. And that's like a knee chest. So even older kids do that, like at 2 years old. They'll just squat all of a sudden. A child with diabetic ketoacidosis has Kussmaul respirations. This is a compensatory mechanism for what acid-base alteration? So DKA, what is that acid-base alteration? Kussmaul is trying to correct it because the body always tries to take care of itself. So DKA is metabolic acidosis. Because of the formation of ketones, those ABGs are really low, like 6.9, and normal is 7.35, 7.45 pH. Now, with those respirations, what they're doing is they're trying to create an alkaline state by these slow, long respirations. So they're trying to compensate, and they do that with respiratory alkalosis. That alkalosis maybe will take care of that acid. It's that balancing act there. Child is admitted with persistent vomiting and an NG tube is inserted. What finding should report it to the healthcare provider? Okay, this question, let's look at it. Persistent vomiting, so you've lost fluid in vomiting. Doesn't say how long, but it's to the point where they put an NG tube in, which also is sucking out fluid out of the body. What are you concerned about with all this fluid loss? It's the potassium. Potassium of 3.1, it should be 3.5 to 5. And if it's lower than that, you can have cardiac dysrhythmias. A 7.44 pH is absolutely normal. That's nothing we would report. Which foods are appropriate for a child with celiac disease? Remember, celiac disease has to do with the absorptions of foods in the small intestines. And the child with celiac disease has a hard time absorbing fat. That's why they're losing fat-soluble vitamins and they have these really smelly, foamy stools. Now, wheat, rye, barley, and oat, anything with that, which is like everything with bread, they can't have. Cream corn, dairy, ice cream, eggs, meats, vegetables, fruit, those are all good. Rye crackers, absolutely not. So mom hides a toy under the infant's blanket and the infant looks for the toy. What is that called? And that's called object permanence. I mean, this actually is amazing that infants, even young ones, you show them something, they are going to go looking for it if it's hidden for whatever reason. And they actually use their muscles and, you know, their cognition on where is it? I'm going to find it. I mean, the older children will see mom put the toy back in the toy box and they're going to go back, creep up and grab it on you. That is what we call object permanence. Even if I can't see it, I know it's here somewhere. While measuring a head circumference on a 3-month-old infant, the nurse notices an increase of 5 inches. What action should she do next? What should she look at next? An increase of 5 inches, even if that's from birth, that is too much. And when we're thinking of infants, we're thinking of heads, think about the fontanelles, because if it's increasing, we're thinking what? Hydrocephalus, right? And we could know that by how much that fontanelle, is it large, distended, and does it bounce like a trampoline? There's a problem. And this is a child at rest sitting up. They should have a flat fontanelle. If it's not, this is something we need to get to the doctor and let them know what's going on. A 3-month-old with GERD has lost weight from the last appointment. How can you increase calories and decrease vomiting? It's a 3-month-old. Very naturally, you don't need to add medicines here. So small frequent feeding, they're still going to have reflux. What you can do is if you have an ounce of formula or breast milk, you put in 5 mLs of rice cereal. And what it does, it thickens it. And when it's thickened, it holds it down. Now, how do you increase calories? Well, you're not vomiting anything, so you're holding on to it. You may not absorb that rice cereal. You might see it in the stool, but you're keeping down now the milk. And that is our goal here. I mean, yeah, you're going to do maybe smaller feedings, maybe better burping, et cetera, but thickening that formula does really work. What is the most important reason for implementing discipline for infants and toddlers? You know, what do we know about infants and toddlers? We can't let them just do what they want to do. They need to have discipline. These are those age groups that like to have structure and routine in their life. And because they like that structure and routine, they know if they do something wrong, they're going to say something because they know it's part of it. And it gives them a sense of security because they know what's happening next. A newborn is noticed to have a hypospadias, and the parents want to know when this should be repaired. Hypospadias, what is it? Well, the opening to the urethra is not the end of the penis in a male. It could be ventrally underneath the penis, hypospadias anywhere, or dorsally anywhere on the top is the epispadias. This is usually done before they're potty trained, okay? Now, this is the condition that we cannot circumcise these children. And remember, in the Jewish faith, part of their beginning in males is, you know, the rabbi doing a brisk. Well, they can't. They need to leave that foreskin there. It is used for closure. They fillet the penis open and they create a tube that goes from the, you know, the penis all the way to the end, and they close up the outside. They insert a catheter, close it up, and then that catheter is left there for about 2 weeks. Now, we do nothing with that catheter. We just keep it inside the diaper so you're not having drippage of urine everywhere. That's all we do with it, and it heals properly like that. But before potty training, that's the important thing. What would be the drink of choice for a child with sickle cell disease on a hot summer day? They're outside at the park with mom and dad. What do we know about sickle cells and dehydration? I think this is what this question's talking about. Hot summer day, they're sweating. Dehydration causes constriction of vessels, which will cause a sickle cell crisis. Actually, lemonade is the best one here. Milkshake is thick and phlegmy. No. Diet Coke, we don't want to give diet anything to a younger child, but cola, caffeine causes constriction, and also tea also causes restriction. Lemonade right here is your best choice. A multi. An infant with diarrhea is lethargic. What assessment findings would be consistent of dehydration? Remember, dehydration in children is very lethal, very deadly, and we need to correct dehydration as soon as we can. So a kid with diarrhea, usually we give oral electrolyte replacement. In a kid with diarrhea who's lethargic, they need quick rehydration. That would be IV fluids. What do we know about dehydration? Elevated heart rate, decreased blood pressure, prolonged capillary refill, decreased urine output. You could see sunken eyes, and younger kids, the infant, crying, no tears. You ever seen an infant cry with no tears? And you'll see them, their eyes are usually sunken in too. It's actually pretty sad to watch, but give them that bolus of normal saline and these kids do better really quick. Chinese child just finished treatment for pneumonia, and you notice round bruise-like blemishes on the chest. Nursing action, what are you going to do about that? Why would a kid have round bruise-like blemishes on the chest? What is that? Is it the antibiotic? Is it child abuse? Have they had an accident? But it's round. Well, remember, different cultures have different homeopathic beliefs. And one of the things Chinese do is what we call cupping. And it's on the chest because that's where the lungs are. They're trying to pull out that bad bacteria out of the body by cupping. They firmly believe in it. So I'm going to ask, so what were you doing, on the chest? Where is this from? Ask the question. And they're going to tell you, well, we believe in da, 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 da. And you know something, you've respected their cultural beliefs and you found out the reason, and then you didn't report them because it looks like child abuse. Sometimes they do it on the back when you have back pain too, but this is the chest because that's where the infection was, pneumonia. What statement indicates understanding of the mode of transmission of Lyme disease? Lyme disease, I've seen a couple of these, and it's been sometimes really hard to diagnose. So if we can prevent the transmission, that is key. Because those kids can get really sick with it. So what do we want to do? We want to cover up as much as possible if we're around areas with a lot of ticks. This could be in woods, this could be in fields with big grass, could be around a pond, but put on long pants and long sleeves, and then there's a smaller area where ticks can get to, and you actually can see it a lot easier too. How can you prevent diaper rash on a 4-month-old? The one thing about diaper rash on infants, these kids will urinate at night and these kids will be crying because that acid of the urine burns. So if you can do something to prevent diaper rash, you're going to sleep better also. So using a barrier cream, whatever it is, doctors have different things they like, and everybody, parent is a different like, but something that's not water soluble, something that will stick on there. And you don't have to get all of it off during every change. Just reapply after, you change a diaper, after you wipe it off. That's it. And you'll get better sleep with that one. How do you evaluate the effectiveness of thyroid therapy in a 5-month-old infant? So obviously the kid was born, they knew it had thyroid issues, and they started a supplement. We know that if an infant doesn't have enough thyroid hormone, it really impedes upon their cognition, fine, and gross motor skills. This is what we know. So what are we going to be looking at? Are they up to date on fine motor and gross motor skills? So at 5 months, they should be able to turn from belly to back, and they should be able to talk to you. They probably are reaching, and they're almost even starting to do, not reflex anymore. They're grasping things by themselves. And then we know cognition, they're doing good. And then the other thing with thyroid is growth. They're gaining weight, their height and their weight, and it's doing good. Those things tell you thyroid hormone is working. A 3-year-old with congestive heart disease, pulse is getting lower over several hours. What else needs to be reported immediately? So you have congenital heart disease, something's going on. The kid has a heart that's just not, made right. Whether it is, tricuspid atresia, left ventricular hypertrophy, something's going on. Now, the next thing we're going to look at is let's take a blood pressure because heart rate's getting lower. Are we perfusing? Well, that blood pressure on a 3-year-old is too low. Again, this is why we need to know vital signs on the different ages of children. Urine output of 20 mLs an hour is actually good for this age for a 3-year-old. It's 30 mLs for adults. 20 on a 3-year-old is perfect, okay? A toddler needs a lumbar puncture for a possible meningitis. What teaching should the nurse provide? I mean, it's a toddlers, ages 1 to 3. They understand, and they need to understand what's going to happen. They don't like things coming at them that they don't know. They do better when you teach them. So they need to be sidelined, their knees up to the chest for the procedure. I've done many an LP for physicians because I'm soft. And I tell the kids, I'm going to give you the big hug. I'm going to hold your head. I'm going to hold your knees. I'm going to pull you close to me. And I'm going to give you the biggest hug. And the doctor's going to touch your back. So I've opened up that spinal column in this hug. And they can do these LPs so easy. So the kid understood what was going on. And I gave him a hug. And most kids like the hug. Parents want to have more children after their son was just diagnosed with Duchenne's muscular dystrophy. What are you going to tell these parents? What do you know about Duchenne muscular dystrophy? It's a progressive degeneration of muscles, right? And they usually don't get diagnosed till about 3 years old, up to 7. And it's mostly boys. It is boys here. But we also know it is inherited through mom, X-linked recessive, and it's your males. So this is something that we would tell them, if they want, they can go some genetic testing. But many parents, well, if it's going to be another boy, we don't want to have another child because it does require, a lot of care. These children are cognitively delayed. They need a lot of therapies. And usually by those teenage years, their heart or their lungs fail and they die. So it's not a great outcome. You find a child unresponsive, you yell for help. What action should you take next? It's in the hospital. You walk in, kid's on the floor. So what you need to do is remember, it's always respirations. So they're not breathing. You have ambu's in every room in the hospital. Give 2 breaths and yell for help, and then start compressions after we check the artery for the pulse, etc. Airway's always number 1, okay? A 2-year-old children are playing. What type of play would you expect? Toddlers, when they play, what is normal for this group of children? What type of play? And it's mostly parallel, which means They're there, they're playing, they're paying, but remember, everything's me, mine at this group, toddlers. That's what they are. So these children don't like sharing, so they play by themselves. They don't try to share with anything. They're playing next to each other, but they're both playing. It is parallel. Very good, guys. An adolescent with type 1 diabetes checks his blood sugar before bed and it's 60, and he ate 4 hours earlier. What does he need to do, and what should you do for this? You know, I always tell you, with anything with diabetes, it all depends on patient condition, okay? He's saying he checks his own blood sugar, right? So he's alert, but his blood sugar is low. So let's give him a bedtime snack with some graham crackers and milk. And why do we add peanut butter? It's high in protein. It lasts longer, okay? Glucagon would be an unconscious child. This child checked his own blood sugar. A 4-year-old with an NG tube states, I'm going to throw up. What should the nurse do? Well, what is an NG tube used for? And this has happened to me quite a few times. It's one of the reasons why, as I come on and do my assessment, I check and irrigate that NG tube and make sure it's patent. Because throwing up with an NG tube, oh, that hurts, okay? So if this happens, you haven't had a chance to check it yet, always irrigate it to maintain that patency, because it's easier to suck that fluid out than it is to throw up, okay? And then, of course, making sure it's in at the proper distance, that it hasn't come out, because, you know, kids moving around, it can. What food should you restrict from a child with chronic renal failure? When we're talking chronic renal failure, you have to monitor their protein, which is meats, okay? Dairy, carbohydrates, fat, not as much. But with chronic renal failure, you have to limit the amount of meat, protein in the diet. Signs of meningitis in an 8-year-old child would include. Now, these are all those signs you've learned a little bit about, most of them. This is something you should look at before you go to a HESI. They're going to ask you questions involving that. It is called Kerning sign. Signs of meningitis. You lift their legs up, they pick their head up. Kerning sign. They're showing you that their back and their head hurts. A child received an irreversible head injury after struck by a truck. Who should approach the family for organ donation? You know, one of the hardest things is to be in the emergency room. You get a kid in that, you know, we know almost immediately there's irreversible head injury. They've got pupils dilated, fixed. You know, the kid's not moving or doing anything. And you're like, the organ donation transplant coordinator has to be called at that point to start to see what we can do with the family. Hardest thing, and especially in children, you know, that we're going to ask, can we have your organs of your child? I mean, they've got a kid who just got struck by a truck. You know, they're going and they're grieving. Very, very difficult thing to do. But how many kids can you save? I mean, I was telling someone earlier about a kid with a hypoplastic heart who at age 8, his heart was failing. He was in the hospital and he was close to death. He was on full support. And I mean, the only thing is he wasn't intubated yet. And it was the night before he went to sleep, the next day was Valentine's Day. And the mother was crying. And he says, Mom, don't cry. Tomorrow's heart day. I'm getting a heart. Guess what? 4 o'clock in the morning, they got a call. Somebody gave the organs, gave the heart. This kid is now 18 years old with that heart. So transplant is a big, big thing, okay? Personal protective equipment for a child diagnosed with SARS include: always know what you need to wear to protect yourself. And you're not only protecting yourself, you're protecting other children, because you come from one room to the next room and you could spread disease very, very easily. SARS, you're head to toe covered. You know, gowns, gloves, mask, eye goggles, shield. Absolutely protect yourself. And then, of course, always hand washing. What findings would you see in a child with celiac disease? Well, remember, what's celiac disease? Let's go back. They can't digest fat, right? They're going to lose their vitamins. They're going to have these really frothy stools. But why are you going to have, if you're given fat? Well, an excess of fat that you don't absorb is extremely gaseous. So these stomachs get really big. So you'll have a protuberant abdomen. It's all full of gas. It has to do with fat ingestion and the disease because they don't digest fat. A 3-month-old infant just had a cleft lip repair. To prevent trauma, the nurse should what? Well, we also know they shouldn't cry, right? That's something that we talked about. One of the first questions here. There's also a Logan bar, this metal thing we could put there to help. But these kids get their fingers up there and they start playing with it and touching it and sucking their fingers, and it could create damage. So soft elbow restraints will hold their elbows out. They can't get to the lip. And with that bar there, they can't smush it inside the bed anywhere. And that will protect the lip so they get a good plastic closure. How do you assess fontanelles on a 4-week-old infant? And the best way is having them sitting upright, not laying down. We want them sitting upright, and it should just be flat. That's what it should look like. If it's concave, they're dehydrated. If it's bulging, there may be hydrocephalus going on there. A 13-year-old girl is evaluated for possible Crohn's disease. The nurse expects to prepare her for which diagnostic study? Well, what does Crohn's disease affect? This is something you have to be careful with. Diet, it's usually treated with some steroids, sometimes biologics, but it's all about the GI tract, okay? Excuse me, there's areas where it gets really inflamed, irritated, and they need to go in and do a biopsy and to see how much that irritation is. What complication of carbenzapine, which is Tegretol, is prevented by weekly blood tests? And this is something we need to tell our patients in discharge planning about this drug. This is used a lot in seizures, okay? And it causes bone marrow suppression. I mean, remember the polypropyl, which is PTU for hyperthyroidism? Now, that causes leukopenia and sore throat. So those patients need to know that. Similar, but not quite. Bone marrow suppression means their body can't tolerate infections at all. So we need to teach them how to hand wash, how to keep themselves safe from getting infections from other children, families, etc. And if it starts to happen, they get infections, they need to call the doctor. What signs and symptoms should the parents of a child with congestive heart failure report to the healthcare provider? Well, what is congestive heart failure? It means the heart's not working as well as it should. and fluids build up in the lungs. And they don't get excreted. And all that extra fluid weighs weight. So you're going to see a sudden weight gain. That's congestive heart failure. The heart can't push it away, squeeze it away. The lungs fill up. And this is how we'll even be monitoring if giving those diuretics and maybe something to help that heart beat better. We know it's going to improve when we see the weight coming down and we see that output starting to increase and watching intake output. Again, all about fluid balance. And last question, a multi. What instructions should the nurse reinforce to parents of a child the application of a cast for a fractured right ulna? You know, kids, the biggest thing is wrist fractures. Fell off the monkey bars, put his arms out to protect themselves, and fractured the ulna. Got a cast. What are you going to teach them? They're going home with it. I mean, yeah, we don't want it to get wet. That's always a big deal. But we're going to be checking those fingers, making sure there's good blood flow going there. We're going to wiggle those fingers to make sure that we keep that circulation elevated. And Tylenol is the drug of choice for pain. It works better than ibuprofen and is recommended. And let's see how we did tonight. Number 3, Cynthia, good job. Number 2, Pinky, good job, Pinky. You had a good night. And number 1, Kara, good job, Kara. Shay and E.T. All right, remember, I'm going to be posting information regarding going and looking at next gen questions and doing them within your the Evolve area. Also, I'm going to be sending you information about checking to make sure you're signed up properly, because some campuses didn't do it in the right place. And so if you already signed up, it's wiped out. So I'm going to be sending you that tomorrow. I'm also going to be checking places where you can look at for things like next gen questions, etc. I'm going to send them to you. And I'm also going to be bringing some next week. So remember, next week is a class. I will be here for you and I'll have those grades out for you by tomorrow. So thank you guys for a good class. I appreciate it. Have a good weekend.